Welcome to Adapt NCLEX. I have 85 questions, NCLEX questions. They are organized by client needs from the Adapt NCLEX Q Bank. We're going to talk about health promotion, physiological integrity, management of care, and all the subunits of NCLEX category. Are you ready? Let's dive in. First question, you have a 55-year-old male present to the emergency room with complaint of what? Intermittent mid-epigastric pain, dyspepsia, diaphoresis, fatigue when going up the stairs and doing garden work. Symptoms last for a few seconds and relieved by rest. Occasionally, times help with the pain. He came in because symptoms are occurring at rest. EKG, borderline, ST elevation, no key wave, cardiac enzymes are normal. How do you do case study? Read the question, first two sentences as the most important. If you read it and you can figure it out, it's okay, but try to find the buzzword. He came in with chest pain. And this is the main thing, the first two sentences. He came in with the complaint of intermittent epigastric pain, with dyspepsia, some fatigue, and then what? Diaphoresis when going up the stairs. This is the problem. And he came in because it's getting worse, but this pain is relieved by rest. Therefore, I know this is a cardiac problem. EKG is confirming that. Therefore, any sentences in that question should confirm it. You stay with the first two sentences and use it to answer the question and figure out what the patient is having. Now, what is the most likely condition the client is experiencing? This is consistent with what? Angina, right? It's not aortic dissection. If it's aortic dissection, you'll be talking about what? Pain or chest pain radiating towards the back, right? And it's a tearing chest pain. It can be unstable angina and no relief at rest. You'll be sitting down, you get the pain, or when you exerting yourself, both. But when you exert yourself and you have a pain, it's a stable angina. Reflux is mostly reflux. This is not consistent with that. So this patient has stable angina. Cardiac catheterization was recommended. Which of the following nursing action are appropriate? When you're doing cardiac catheterization, we're going to give you contrast. Therefore, when you see that question, focus on the contrast and things you want to prevent to cause problem. Number one, evaluate the client for what? Shellfish allergy. This is no more needed. It used to be if you have shellfish allergy, you can get contrast. So this is a trap. So don't worry about it. It's a select that apply. You pick those that you're confident. Don't over-select. Obtain basic metabolic panel. Yes, we're going to give you a contrast. We have to worry about your kidney. Assess for IV contrast allergy. That's what we talk about. Number one, ask for large dose of metformin. It can cause lactic acidosis with IV contrast. Inform the client that warm or flushed sensation may occur when the IV contrast is administered. Yeah, consistent with what you will see. Inform the client about an incision on the chest. No, we go in the cardiac catheterization, we're going through your groin, not your chest. Watch that. NCLEX will trap you that. It's an incision in your groin. It's a tiny stab wound in your groin, and we're going to your heart through the groin using wires. So this is a trap. Now, what is the problem? The next thing is the patient undergoes successful cardiac catheterization with placement of stent. That's the key, stent, right? Which of the following interventions should the nurse include in the plan of care? This is the question. Resume metformin immediately to prevent hyperglycemia. Think about it. Monitor groin incision frequently. Keep the client bed rest for 24 hours. MPO for 12 hours. What do you think about it? Put down your answer in the comment. Pause the video. This is the classic question you may see on the NCLEX, whether it's a standalone or in the case study. If a patient had a contrast, what do you think we should do? What do you think we should do if you have a contrast? Contrast study, what are we going to do? What are we going to do? MPO for 12 hours is too long, so we're not going to do that. Keep the client at bed rest for 24 hours. Are you going to do that? No. 24 hours is too long. 6 hours is when we're going to keep the leg flat, but after 6 hours, it's okay to mobilize. Monitor groin incision frequently. Yes, we're going to monitor the groin incision frequently to prevent hematoma. Assess for what? Lower extremity pulses. Yes, because they can have thrombosis. And metformin should wait for what? 48 hours before you can resume it. And so this is what you do. B and C are your right answer. Now, 3 hours after the procedure, the client became anxious, diaphoretic, alert only to person and place. And they report what? Back pain. This is classic NCLEX question. Patient had cardiac catheterization, all of a sudden complaining about back pain. The buzzword is what? Back pain. Please write this down. Cardiac catheterization with back pain 3 hours later, patient is bleeding. And this bleeding can go into the groin. It can go into the periumbilical area, and it can go in the franchilia. These are what we call curling and greater and sign. On examination, there is ecchymosis around the periumbilical area, bilateral frank, and a perineum. So what is going on with the patient? He's bleeding. He's in shock. Therefore, what do you expect? Which of the following findings should the nurse anticipate? I am in shock. What do you see in the shock? Hemorrhagic shock, bradycardia, hypotension, dark urine, cold skin, and what? Capillary refill for seconds. This is testing your knowledge on physiological adaptation, but it's a case management. What do you think the patient would do if they are in shock? If I'm in shock, what am I going to do? Do I expect bradycardia? I don't think so. I'm going to have hypotension, classic. Do you think my urine is going to get dark? Put down in the comments. Let me know. Yes, a shock patient is going to do that. Your skin is going to get cold because blood is going to go to your brain and your heart, not to your skin. Your capillary refill, that means how long it takes for your blood to go through your capillary when I squeeze it, is going to take longer time. It's going to take what? Longer time, not a shorter time. When you are in shock, the time it takes for your capillary to refill is longer. So 4 seconds is an expected finding. These are constant information you should be aware of. So that's the patient. The client was resuscitated for what? Suspected bleeding and is being discharged home. Now he's going home with Coumadin following the stent. Which of the following statements require immediate intervention, right? This is the same thing you know. They put it in a case form. If you have Coumadin, I got to teach you. So case study is just a collection of things you know. Now patient is going on with Coumadin and he has a stent. What would you teach them? I will need frequent lab draw. What do you think? I will increase fresh living vegetables intake. Do you think it's so? I will decrease my vitamin K rich diet. What do you think about it? I will use acetaminophen for pain. Should you do that? I will buy a new electric clippers for shaving. What do you think? Put down your answer choice in the comment section. But these is things you need to know about Coumadin. All the questions are concepts from Adapting NCLEX QBank. Was we don't want you to cut yourself, so use electric shaver, no razor blade. You can use NSAID. Acetaminophen is better. The thing about Coumadin that NCLEX will trap you, I want you to write it down. Don't change your diet. Don't change your diet. Don't change your diet. What does that mean? If you eat 2 grams of vitamin K, I want you to keep it. Don't increase it. Don't decrease it. Consistent amount of vitamin K rich diet. Once again, consistent amount of vitamin K rich diet. So that's a trap. Which is B and C are saying the same thing. I'll increase my fresh living vegetable intake, and C said I will decrease vitamin K rich diet, saying the same thing. I need frequent lab draw. So you need a frequent lab draw. So that's what you need. That's that patient. So that's the case study. It's done. But this is the way you can go through these cases easily. If you need more, check out Adapting NCLEX. I have a bunch of case studies, and I'll link some to this video. Case number 2. What do we have? 27-year-old woman delivered vaginally 48 hours ago. She report what? Foul smelling, vaginal discharge, and heavy bleeding. This is what? Health promotion, maternity question. She's changing the pad every hour. She report what? Pelvic pain and chills. Vitals, temperature 102, heart rate 110, blood pressure, 11, blood pressure 170, and the fundus is firm, located below the umbilicus. This is the overview. Now let me show you how to read a case study. What you do, you take your time. If you're taking the NCLEX, take your time. Now, focus on the first two sentences. What? And look for the buzzword I said. 27-year-old woman, okay? Deliver 48 hours. Very important. And what is happening? Foul smelling, vaginal discharge, and heavy bleeding. And changing pad every hour. And she reports pelvic pain and chills. Why? 48 hours, I'm having discharge, but not just a discharge, it's smell. That should be your buzzword, foul smelling. And it's bleeding too. Two things. The thing is bleeding, and then also it smell. And I have fever and pain. That tells you it's something else. Something that I know you think is going on with this patient is not. This is a both type question. But look at it. When I give you vitals, I do not give you signs and symptoms of shock. This is the way you can analyze case study. You have temperature is high, tachycardic, but blood pressure is borderline normal. If I think bleeding is the problem, you have hypotension. That should trigger you that this is not something about bleeding. It's something else. Focus on the foul smelling. This is a classic NCLEX case study. You may see. And then I told you the fundus is firm and located below the umbilicus. That means the fundus of the uterus is not that means the uterus is not the one bleeding. The bleeding is something causing the uterus to bleed. And that is the case study you may see on the NCLEX. And when you see it, I want you to think that way. Therefore, what is the likelihood? This is a both type question. The patient experience, what is the experiencing? Go to the middle. This is how you answer both type question. Always go to the diagnosis. Never look at the left and right. If you make a diagnosis, you're going to get 5 points because you know what to do. I've already explained to you the diagnosis. We don't think this is uterine infarct because then the uterus will be bigger and tired and it will be boggy. That said, the uterus was what? Firm and contracted. Negative. It can be retained placenta fragment because the same thing, if there's something in the uterus, it will prevent it from contracting. This is not it. You see an itis infection and is coming from what? Endometrium. The endometrium is the uterus. So the uterus has infection and the infection can cause bleeding and it's been 48 hours. It's classic endometritis. Vaginal hematoma, blood is not going to come out. You see concealed blood. That means what? You will see hematoma in the perineum when you look at it. This is the way you answer both type questions. Therefore, this is our answer. Apply eyes to the perineum. If you know the answer choice, the diagnosis, then it's easy. If I know this is endometritis, then I just look and pick something that I can use to treat endometritis. Eyes is used for what? Vaginal hematoma. Massage the fundus is for atony. I'm left with these two, and I'll give it to what? Endometritis, because that's the one I should pick to. And if I'm giving you antibiotic, I should check your temperature. If I'm giving you what? Checking your blood culture, what is causing the infection, I got to check the local quantity. Both type question. So what is the client? What is the problem? Endometritis, right? What are the two things we're going to do? Well, antibiotic and culture. And then what are we going to monitor? Temperature and local. Question 3. This is classic NCLEX question. This is the way I want you to think about it. Now, highlighted information. Which one you should question? That's what it's going to be. Client is a 68-year-old male admitted with what? Confusion, agitation, buzzword. Wrist restraint were applied at 9 o'clock for safety after client attempted to pull out IV. Restraint were secure with what? Quick release knot to the bed rail. This is the way I can teach you restraint, right? Client circulation was checked and the skin appeared intact, right? Client was calm after restraint applied. Client family was notified. We'll continue to monitor every 4 hours. Need to renew restraint 48 hours. So look at the highlighted information. Restraint was secured with what? A quick release to the bed rail, right? The circulation was checked. Why? And then in the next step, we'll continue to monitor every 4 hours and need to renew the restraint 48 hours. Concept about restraint, write it down. This is a concept about restraint. You may see this question standalone. It's the same thing, but I try to make it highlighted. Which highlighted information should the nurse be concerned about, right? Restraint secure with a quick release knot. Restraint secure to the bed rail. Circulation assessment. Monitor every 4 hours. Renewal of restraint in 48 hours. This is NCLEX concept regarding restraint. Usually you tie them with what? Quick release. So this is good. Restraint should secure to the bed rails. That's wrong. The non-movable portion of the bed. So this is we should be concerned about. Circulation should be checked. But when? Every 2 hours, you should check the patient, not every 4 hours. You need to renew restraint, right? But the time is every 24 hours. So these are the concepts. These are the ones the nurse should be worried about. So we have to be concerned about. As you can see, we change area. Question 4 teaches something else. This is management of care. And that's what we continue. Which action by the nurse is an example of negligence? You have to know the definition of negligence. Withholding a medication because the client refuses it. What do you think? Failing to put on side rails for sedated client leading to a fall, explaining the risks of procedure before consent, reporting unsafe staffing to the charge nurse. Negligence is failure to do something that you are supposed to do. If you fail to do it and something happens to the patient, they can use it to sue you. That is more practice if there's a damage done. Therefore, in this patient, which of these indicate the nurse is being negligent? Withholding the medication because the client refused, you are not being negligent. She said, the patient said, I don't want it. Failing to put on, you see the word bed rails, and the patient fell, that's a problem. Explaining the risk of the procedure does not indicate you're negligent for that. Reporting unsafe behavior, you're doing good. Therefore, this patient is in trouble. A client developed a pressure injury after a nurse repeatedly failed to reposition the client despite orders and standard of care. What does they indicate? Battery, malpractice, negligence, and assault. Straightforward, right? This is a bonus, management of care. But as explaining with the previous question, what did I say? Negligence, you failed to do something. But then if there is a physical harm to the patient because of your negligence, it becomes malpractice and it can sue you. The failure to turn the patient, right, repositioning the patient is negligence. But now, what has happened? Patient has developed pressure injury. The presence of the pressure injury, you have committed malpractice. There is nobody, you not touch the patient, injure them or anything like that, or assaulted them in any way. Bear with. And this is the short adapted class explanation from the Q bank. And next is notice tension between two colleagues, but chooses not to intervene or mention it to the manager. These are management of care questions. They are raw, they are very annoying, but you have to be comfortable because NCLEX love it, right? So be comfortable answering that. What conflict resolution strategy is this? Go, don't look at the question, look at what is happening. The nurse notice tension. There's tension between the two colleagues, but chooses not to intervene and mention it. That means I don't want to get involved. I'm not compromising. I'm not collaborating. I'm not competing. I said, I don't want to be involved. Avoidance right there. That is conflict resolution. That's the way resolving the conflict. Indifferentness. A nurse is scheduled for a training session. Why? But then agree to swap shift with a coworker who requests the same day off for personal reason. Think about it. I'm going to go to the training. Another person say, oh, let me take your shift because I have personal things to do. What are you doing? Collaborating, accommodating, avoiding, and compromising. These are words, if you think about it, you can see that it makes sense. Avoidance, she did not avoid the meaning, right? She compromised. No, she did not. Compromising means 50-50, right? You're compromising, right? Accommodating, basically, you're letting the patient come in and then the person come in and you lose, right? You accommodate them at your own, basically, you losing and giving them the opportunity to use whatever they want. So that's an accommodation. Collaborating is coming together and working together. So this is accommodating. She's accommodating the nurse. A nurse is caring for a client with what? Left forearm amputation. At discharge, which referral is appropriate to assist with what? ADL. This is what we call interdisciplinary team approach. Who are you going to refer somebody who have traumatic amputation, left forearm? You have to know what each of them does. Physical therapists, what did they do? Respiratory therapists, what did they do? Case manager, what did they do? Occupational therapy. I'll give you a trick. If they involve activity of daily living and you have to use your fine motor skills, always choose what? Occupational therapy. Or you can draw your hand like that. And this is NCLEX. If it's below your elbow, this is all occupational therapies. If it's above your elbow, it's physical therapy. So the physical therapy is the whole body mechanics, but occupational therapy is focused on specific fine motor skills, your hand. So this guy had left forearm amputation. He should be able to now learn how to take care of himself, how to eat, how to dress. The case manager is not the one who help, neither is the respiratory therapist, but it's occupational therapist who may help with the situation. And nurse is working on medical surgical unit. Which task is appropriate to delegate and which task is appropriate to delegate to the LPN? This is management of care. Like I said, we are doing 85 questions. We're going through client needs, and this is management of care. Who, can you delegate to LPN? And what do you think? Performing a focused initial respiratory assessment, educating a newly diagnosed diabetic patient about insulin injection, reinforcing discharge teaching, administering a blood transfusion. Most of the time, if I did not put initial or anything, I will assume it's the nurse who's supposed to do it. Performing a focused respiratory assessment, yes, it's focused, but there's initial there. Educating a newly diagnosed diabetic patient, the word newly is a problem. And reinforcing discharge teaching is what is classic for LPN. That's what they do. They reinforce it. So that's fine. And nurse is assisting in the disaster triage. Which client should the nurse see first? Anybody who have what? Chest trauma is in trouble. That's the thing. Chest trauma and bleeding. That's all you do for triage. When you see triage question, think about shock, airway, and chest trauma. Because when anything involving your chest, there's what? Airway problem and the bleeding. Therefore, a client with open femur fracture and no palpable pulse, the patient has no pulse. Think about it. You got to be sharp. It's simple. Fracture and no pulse. A client with what? Second-degree burn over 70% of the body surface. Do you think this patient is going to live? A client with penetrating chest trauma. I give you the word chest. A client with small laceration and no other injury. What do? Divide it in. Go with the buzzword and the bishop way of answering the question. And you know for triage, femur fracture, back problem. He has no pulse. Maybe he's bleeding, right? Second-degree injury, second-degree burn, 70% of the body. Back problem. He's not going to live. Penetrating chest trauma. I told you, chest is always your priority. Small laceration, no other injury. It's fine. Therefore, who are you going to pick? We're going to pick this guy. Which task can a registered nurse safely delegate to a UAP? Anything that does not require thinking. Anything that does not require thinking. Anything that does not require thinking, and ADL. What do you think? Measuring vital signs on a stable client. And assisting a client with the bed to chair transfer. Instructing a client on incentive spirometer. Documenting intake and output. Performing a sterile dressing change. You see, these are the way the NCLEX asks questions, and it's practical. Don't make the question isolated. Sit back and say, I got this. What am I seeing? UAP, I know. Nothing thinking, ADL. Measuring vitals on a stable patient does not require thinking. I know I'm doing the right thing. Assisting the client to bed is ADL. I'm picking you. Instructing a client, the word instructing, I'm not reading it anymore. Documenting, I'm just documenting. I'm not doing anything. You see, performing a sterile dressing, I can't do anything sterile. So I know you got it. This is the answer choice you got because I can see you. Take care of yourself. Thank you for watching. Thank you for staying. We are on question 12. We're still on management of care because this is big. This is big in the NCLEX, large area. So stay with me. Let's get it done. Prioritization 101. You know how to do prioritization. Divide the thing into two and go for the buzzword and be sharp, not expected. And then she's in emergency department, receive 4 clients simultaneously. Which client should they see first? Divide the thing and figure out. Read it like you're doing, taking care of a patient. And ask yourself, femur fracture, I have pain. Is that what I expect? Laceration on my forehead, and I'm requiring sutures. I have chest pain, and I'm sweaty. And I have ankle spray, and I'm requesting ice pack. Who do you think is in trouble? Right? If you are spraying, you're getting requesting ice pack, good luck with that. Chest pain, you're sweating, you are in trouble. Laceration on your forehead, you need sutures, good luck. Arm fracture, you're going to have pain. Therefore, C is more dangerous. We got to see C. So you can see prioritization is fun when you know how to approach them. So approach them that way so that it does not become something you run away from it. I want you to approach it and feel more comfortable when you see prioritization. You say, NCLEX, bring it on. Same thing. Client admitted with what? DKA. What is the problem? We need sugar. Check. Why? The question is about floatiness. And nurse from the pediatric unit is floated to what? Medical surgical unit. Which client should be assigned to the floater? The floater should get a stable patient, not too complex, something that they're more experienced to do. She's what? A pediatric unit nurse. She's in the message. Give them kids that they can deal with. Client with what? Tracheostomy requiring frequent suctioning. Client 2 days post-appendectomy is just eating. Client with what? Chest pain, cardiac catheterization. And you step back, you said, chest pain, and I have cardiac catheterization, a bunch of stuff. This is all something classic to med-surg. You have appendectomy, you eating. Well, every nurse can take care of this. New tracheostomy, the word new make me worry. And then requiring suctioning. The pediatric nurse will stay away from it. DKA needs so many lab work to be done, and his sugar is being checked everywhere. Our complex patient, why don't you give this patient to the nurse so that she will be happy? And flow nurse should be assigned to a stable client within their competency. Post-appendectomy on a regular diet is a proper patient for this nurse. This is physiological adaptation. We have changed and we have moved. So change your mind. Think about what is going to happen to every patient and think about what you need to do to help them. Patient has chest tube. What should you have? Oxygen, 250 ml of sterile water in the bottle, antiseptic wipe, stethoscope, and tracheostomy tube. What do you think? Put it in your answer in the comment. Pause the video. Think about it. Assume that, make yourself as if you are taking the test, and then put down your answer. Let me know. But you don't need a tracheostomy. You may need a stethoscope. You may need antiseptic wipe. You may need 250 sterile water in a bottle or oxygen. But if you have to prioritize 3, you got to pick 3 items. Oh, well, you got to pick some items. You got to pick some items. So which one are you going to pick? What do you think? Of course, we need oxygen. Of course, we need sterile water. Why? If the chest tube come out from the Puravac, we can put it in the water and go and get another Puravac. Antiseptic wipe, if the chest tube come out from the Puravac, we can clean it and then put it in the sterile water. And this is the way it should be. Think about it. This is the chest tube connected to the patient. If the chest tube come out from the what? The Puravac, it will fall on the ground. What you need to do is to clean it, put it in the basin of water, go get another Puravac and reconnect it. So these are items you should have. Somebody will say, well, I need a stethoscope. Well, most of the time, it's not necessary, but I'll give you to that. If I said 3, then yes. But the question said priority item you should know the nurse you have by the bedside. What would you do? Will you involve stethoscope? Ostomy tube is not needed. The client is receiving continuous IV infusion of vancomycin. The trough level is what? 25. I've given you the range. What is the best action? These kind of questions are straightforward, and I'm showing you the trick. I want you to write down, stop the video. When they give you a question, they give you a peak and the trough. This is the way. The medication, I give it to you, then you go. The peak, and then it comes down, and then it goes up again. So when we say the trough is here, the lowest level of the medication, this is why we redose them, not at the peak, but at the trough. How long does it go down, right? But look at it. The lowest level is still higher than the range of the normal that we wanted, the toxicity. We don't want it to go past that. So 25 is more toxic than the 20. So even the trough means there's too much medication in the patient. So will you decrease the infusion rate? Will you administer the dose? Will you hold the next dose or draw a peak level to verify accuracy? You have something 25. Why do you want to draw again? We need to hold and let the doctor know that our level is too high. Don't decrease it, don't administer the dose. A client receiving furosemide, once again, physiological adaptation, 40 milligram IV for acute heart failure, develop muscle cramps and generalized weakness. Think about it. The key word in the question, the buzzword is what? Furosemide. Which lab results should the nurse anticipate? You know furosemide. What does it do? Think about it. So why we use it? Because it decreases your potassium. At the same time, it decreases your sodium. That's why we use it in heart failure. So which lab results should the nurse be anticipate, right? Hypokalemia. Straightforward, right? That's all. Because it's hypokalemia because the patient is having weakness, and that's what is causing the problem. How are you doing so far? I know, stay with me because these are questions that shows up on the NCLEX. These are from Adapt NCLEX QBank questions. I can see that the level of percentage is very low, and I'll put them together to make these questions. So let's get it down. And I want you to know some of the tricks that I'm using to answer the question. Write them down so that you can master them. When you see any question, use the same concept. Which electrolyte imbalance does the nurse suspect? What? The client with prolonged NG tube suctioning become lethargic and confused. Is it because of hyperkalemia, hypernatremia, metabolic acidosis, and metabolic alkalosis? Don't worry, there's a strategy to answer this question. You may not know all the things, but you know enough. Trust me, you know enough. Go for the buzzword, NG tube suctioning. All of a sudden, lethargic and confused. Forget about everything you said. NG tube, if I put the NG tube in you, I'm sucking all your acid out. What is going to happen? You develop what? Metabolic alkalosis, not acidosis. Therefore, I've eliminated. Your potassium is going to go low. It's hypokalemia. Your sodium is also going to get low. Hyponatremia. Therefore, you're left with this. This is why the patient is confused. Think about it. Metabolic alkalosis, how do you compensate? You're going to compensate it with respiratory what? Acidosis. Respiratory acidosis. And these can lead to lethargy, confusion, and the patient getting sick. So this is what is happening to the patient. So watch for that. This is why metabolic alkalosis is more dangerous. And that's our right answer. Think about it. This is very, very key. So we'll stop this video here, watch it multiple times. Electrolyte physiological adaptations can be very difficult. And this is the way we think about it. This one is a bonus one. But if you don't know it, it look like intimidating. It's not. Which client should the nurse prioritize for intracranial monitoring and monitor? That means the ICP is high. Convert the question the way you know it. A nurse is caring for a 4 client in the neurosurgery ward. Or I'm telling you, somebody with ICP is high. That means their GCS should be lower. That's all. If you calculate this, GCS is what? This is 15. It's a normal patient. The GCS is what? This is what? 13. It's okay. It's in a mild brain injury. If you look at this, it's 3 plus 1. This is 8. You need to intubate him, right? This guy is also what? 14. That's okay. No, this is 13. The last one is 13. What do you think? You got to intubate this patient and care for this patient. That's the key. So all of the questions you can see is tricky. A client with type 1 diabetes present to the emergency room with what? DKA. Which finding should the nurse anticipate? Classic NCLEX question. How do you answer the question? Read it from the back. It's a select that apply. Don't pick everything. What did they say? Finding, underline, finding. That is expected, right? Anticipate. Anticipate this. That means, and what is it? Type 1. About what? DKA. What is DKA? Write it down. Diabetic. Your sugar is going to be high. Ketoacidosis, right? You're going to have some ketones. Acidosis. You're going to have acid. Therefore, fruity smell, ketones, rapid deep breathing associated with the acidosis. Your glucose is not going to go more than 700. That is what? HHS, right? pH, you're going to be acid. This is not acid. Your mucous membrane is going to get dry because you're going to get dehydrated. And the dehydration causes abdominal pain. You see the way I answer the question? All from the question that is giving me. I just break it down with the content and I look at it and I say, DKA, I'm using you to answer the question. So use the DKA to answer the question. Therefore, we have 1, B, E, and F. Next question. A client prescribed digoxin 0.125 milligram daily for heart failure. Before administering the medication, the heart rate is what? 54, potassium 32, digoxin 2.3. Too high, right? What is the next priority action? You have bradycardia, you have hypokalemia. All of them are bad problem for digoxin. Therefore, what do you want to do? Administer the digoxin as prescribed, notify the healthcare provider of the assessment finding, or the digoxin, reassess the heart rate in 1 hour, administer potassium supplement before giving digoxin. Trappy answers, right? Trappy answers. Which one would you pick? They sound nice. When you see answer choice that sound nice, just ignore it. Focus on the data that tells you, hey, you got to wait. Don't do that. Heart rate low, hypokalemia, digoxin should never be given. Therefore, I'm not giving you potassium. I'm not going to assess you an hour and decide to I want to give it to you, even though it sounds right. I should let the doctor know we have a problem, and I should never give the digoxin. 22. How are you doing so far? We are on physiological adaptation. I said client needs. I grouped them in client needs so that you can see them. And these are client needs. So you got to figure out how to get yourself in that shape of physiological thinking. If you're watching this video to study, always go into your mind, say physiological adaptation. I got to fix something, prevent injury. A nurse is caring for a 2-year-old child with a high fever, buzzword, drooling, buzzword, and stridor. The child is sitting upright and leaning forward. These are our buzzwords. It can be a case study, but I've given you everything. The age give it away. He has fever, he's drooling, he's striding, and he's sitting up and leaning forward. What do you think? What do you call this? What do you call this? This is what we call tripod position. And a 2-year-old drooling with the tripod position, he has epiglottitis. If it's epiglottitis, then what is my priority? Assess the child throat using a tongue depressor, nothing go to the mouth. Administer prescribed antipyretic is not a priority, not the fever is not. Airway is my priority. Prepare for intubation and notify the provider or obtain throat culture. I said nothing go through the mouth. Therefore, why do you obtain throat culture? We got to prepare to intubate. I'm using these questions to teach you guys how to answer questions, approach questions, and test taking strategy. You need a little bit of content to do that. Try to get a content enough to answer it, but you don't need to know everything, but everything can be given through the question and how to approach them. If you need help, check Adaptation. Click subscribe to for more content like that. But this is Adaptation Clips. We also have on demand. You can join our crash course, or you can subscribe to our membership on YouTube. But this is test taking strategy. 85 questions from my Q bank to show you test taking strategy, areas to focus for your NCLEX. And this is caring for a child with what? Tetralogy of fun. You should expect what the question is going to say. Just by saying that, I know. If you master it, you can say, oh, I know what they're going to ask me. The child suddenly would squat during play, tit spell. What is the next best response? What do you think? Encourage the child to stand up and walk, administer oxygen and call for help. Allow the child to remain in the squatting position. Place the child in the prone position. Concept, concept, concept. Tetralogy of Foley, squatting, because somebody told the kid, if you're getting sick, squat to prevent shunt. What would you do? Leave the kid in the shunting position. And what is that shunting position? Squatting. Encourage the child to stand up, negative. Give him the oxygen. It's okay to call for help, but the best thing to do is to prioritization. The word said best. Don't pick number 2. I know a lot of people will pick 2 because it's giving oxygen and calling for help. But the question said best prioritization. Go with the concept of tetralogy of Foley, and that is what? Prevention is number 1. And then it's assessing the client who sustained 45% total body surface area. Which findings should the nurse suspect during emergent phase of burn injury? U-wave EKG, heart rate of 58, peak T waves on the EKG, and then diarrhea. This is a concept. You have to know the stages of burn. The first one is emergent, right? Then we go into the active phase. Then before you go to the end of the transition phase, where usually we call it what? The individual is going to rehab later on. But emergent phase is the resuscitative phase. This is the phase that we're going to see the patient. Patient is in trouble. What do you see? You get burned, or your cell burst open. Your potassium get released, it goes up. Fluid go leak into your skin, and you have all edema. You're going to get dehydrated. When you get dehydrated, you become what? Hyper. You become what? Tachycardic. That's number 1. When you get tachycardic, what do you think? And when you get tachycardic, what is it associated with? Hypotension, because you have lost all the fluid, right? The potassium is leaking, is going to cause peak T wave. Later on, if you get more fluid, potassium go down, you develop U wave. Because of the severe burn, you develop ileus. Why? Because your sympathetic nervous system kicking, and sympathetic nervous system does not cause diarrhea. So what do you think? You can see that this patient is going to have peak T wave. A client with pulmonary embolism suddenly developed hypotension and tachycardia. Which action should the nurse anticipate? Patient is in trouble. Prepare for thrombolytic therapy. Give them furosemide. Place client on bed rest with leg elevated. Start continuous heparin infusion. I have pulmonary embolism. You treat me, but go for the question. There is always, you may have seen this question before, but it's changed. That's the thing. Don't memorize question. Look at what you've been given. Go and break down the question. Pulmonary embolism. I have hypotension and tachycardia. Usually it does not cause that. Patient are going to have saturation issue, and you can know. But now they have hypotension, tachycardia. This is causing shock. This is severe pulmonary embolism. Heparin is not enough. And this is, don't do it. Rest and elevate the leg. You're focusing on hypotension. focus on PE causing shock. You see how you answer the question? Give them furosemide. Patient is hypotensive. Therefore, thrombolytic therapy is the best choice because that will break the clot quickly. Patient is going to die. Which laboratory results support the diagnosis? Physiological, adaptation. And then she's assessing the client diagnosed with what? Diabetes insipidus. Last Wednesday, we did DI and SIDH. These are classic information you should know. It's part of physiological adaptation. Which one do you expect? Sodium 125, urine specific gravity of 1.002, so serum osmolarity of 260, and urine output of that. Don't worry about it in 8 hours, right? Every 8 hours, right? That's a 200 ml and that. Think about it. DI, you have no ADH and you're going to lose all your water. Your urine output is going to increase. P 200 ml, urine output 200 over 8 hours. This is barely 30 ml. That's wrong. Your blood is going to get concentrated, right? Blood is going to get concentrated. So I expect the specific gravity to be higher than 260, normally 280. Your sodium is going to go up. Just by elimination, we have a very diluted urine. And that is our answer. These are the way you approach questions. And even if you don't know, you can figure it out. I intentionally did not give you range, but you can look at the answer and say, this is not right. A client with prolonged NG tube suctioning become lethargic and confused. Which electrolyte imbalance does the nurse suspect? Hyperkalemia, hypernatremia, metabolic acidosis, metabolic alkalosis. Sorry, this question get repeated. We've seen already. We know the answer. We put down and we continue. A nurse care for a client with small cell lung cancer. He has what? SIDH. Which intervention should the nurse anticipate? Vasopressin IV infusion, 0.9% normal saline, initiate fluid restriction, give them D5W. Go back to your concept and say, what is SIDH? SIDH means you're retaining fluid. If you're retaining, you have more ADH. Will you give me vasopressin? Think about it. My sodium is going to go low. Would I get 0.9% normal saline? I'm fluid overloaded. Do I initiate fluid restriction? My sodium is low. Do I give them D5W? Stop the video. Put your answer in the comment. Let me know what you think. Say hashtag number 29, number 28. This is what I pick. But I can tell you, you don't need vasopressin because you have too much of it. Your sodium is too low. 0.9% is too low. We need 3%. Fluid restriction is much better. And then giving them 5W, they're already fluid overloaded. So you should not do that. Therefore, this is the right answer. These endocrine questions are straightforward, and I know you got it. And this is caring for 4 clients. Which client is a higher risk of what? Developing hypokalemia. Once again, physiological adaptation. I make sure I include enough of this because I know it's the area most people get in trouble with. All my students, when they send me their CPR to take a look at it, their report, physiological adaptation, because it's very, very interesting and thinking like that. Which client is higher risk of developing hypokalemia? You know the content. Don't worry. You say, how am I going to solve this? A client receiving IV spironolactone for CHF. A client with 45 degrees, third-degree burn to the body. A client diagnosed with SIDH. A client with high-dose albuterol for asthma attack. Sometimes you see this question and say, what are they trying to do to me? This underlining and dividing, it said, spironolactone. What does it cause? Hyperkalemia. That's what it causes. It's potassium sparing. If you burn yourself, mostly you become hyperkalemia until we give you fluid. SIDH has nothing to do with your potassium. High-dose albuterol is what causes hypokalemia, is an agonist, beta agonist. Is going to what? Lead to potassium shifting inside the cell and leading to hypokalemia. These are how you answer some of these questions. Very straightforward, but it requires you to think out of the box. What I mean by out of the box is a step back and said, okay, It's not hard. I just need to look at the relationship between each of them. And then suspect a blood transfusion reaction. What should the nurse do? What would you do? Blood transfusion reaction. What are you going to do? You suspect blood transfusion reaction. What are you going to do? Stop the transfusion immediately, notify the air care provider, maintain IV access with the normal saline, recheck the blood type and cross-match, discard all IV tubing that contain blood. Is that what you're going to do? Stop the video. I would like to know what you decide to do for 30 if you know that the patient had blood transfusion. I can tell you, I'll stop the transfusion immediately. I'll let the doctor know. I have to maintain IV access so that I can give them fluid to flush their kidney. I'm going to check their blood type and make sure I did not do anything wrong. You should not discard all IV tubing that contain blood. They need to do investigation and figure out what is going on. These are concepts. It's good to know. Never throw any tube away. We want to figure out why the individual have a reaction. We are 30, almost 1/3 away. How are you doing? Your score. And like I said, if you're tired, stop the video, pause it, go get something to drink. We are in this together. We're fighting this together, trying to get the concept down. And then assessing a client who developed carpal pillar spasm. When the blood pressure cuff is inflated, those are the buzzwords. Which electrolyte imbalance should the nurse suspect? Select or apply. Look, I'm going to show you my strategy to answer question again. And we've been talking about it. Read the question from the back. It's a select or apply. I'm not going to pick everything. Electrolyte imbalance. What? I suspect. Why? Nurse did the assessment. For what? Carpal spasm. When what? Blood pressure cuff. Those are my buzzwords. And I picked this. I said carpal pillar spasm. What causes that? Something is going up. And I know there's only 2 electrolytes that can cause spasm. Hypokalemia, mostly on your cardiac aspect. It can cause muscle spasm, but not when you inflate your what? Blood pressure. Hypermagnesium will lower your symptoms. Hypercalcemia will also lower your symptoms. You see what I'm left with? A bunch of hypos, and all the hypos are your right answer. A client with septic shock, blood pressure low, tachycardia, MAP is low, is in shock. Which order should the nurse prioritize? You give them broad spectrum antibiotic, vasopressin, large volume IV, central line. What do you think? Which one will you give it to them? Physiological adaptation. What do you think? Which one would you give to the patient? This is our last question on physiological adaptation. What do you think? Which one? The buzzword. Go for the buzzword. If you need help, let me know. Email me, Adapt English. I'll put it in the description. Check it. Septic shock. The question says shock. So shock, definition of shock is hypoperfusion. And therefore, when I'm treating a patient, I'm going for hypoperfusion. That's what I'm going to tackle first. Broad spectrum antibiotic is dealing with the substance of the organism. It's not treating the shock. Vasopressin, you need to fill the tank before you squeeze it. That means if it's your vein, you got to make it bigger, and then you can squeeze to improve your blood pressure. Large fluid volume, sign to me like I'm doing the right thing. Central line placement, of course, they will need a line, but no central line, right? That's a trap right there, right? So IV fluid is the best answer. Now, you can see we switch gears. This is it. Psych is big on the NCLEX. I'm going to get you through. There's some few questions, but they are eye-healed. I want you to write it down. Integrity, psychosocial. Very, very important. Which findings should be classified as negative symptoms? About what? Schizophrenic client was admitted involuntarily due to inability to care for themselves. So which one is negative symptoms? There's two types of symptoms. There's a positive symptoms and the negative. The negative are those we can use to tell us that the individual is in the depressive mood. Therefore, which one would you pick? Hallucination, I'm up. Disorganized thought, I'm up. Delusion, I'm up. Flight affect, I'm down. Depressive, evolution, I'm down. And anhedonia, I'm down. You see what I did? Don't forget about it. These are negative symptoms you can use to answer question. You can take a picture of it, snapshot it. This is Adapt NCLEX Q Bank talking about positive and negative symptoms. This is like be a full case study, but I'm going to walk you through. Don't worry, I got you. A client with the history of depression and schizoaffective disorder present to the emergency room with what? Right lower quadrant pain. He has pain. Okay. Post-op in the PACU, client developed muscle rigidity, locked jaw, temperature 104, and fluoxetine and lazepine. What is the condition the client was experiencing? Don't worry about it. This is a full case study, but I shut it down. What is the problem? Patient has depression, schizoaffective, came in with the right lower quadrant pain. So he has appendicitis. You should diagnose it. Post-op in the PACU. After surgery, he has muscle rigidity, locked jaw, temperature of 104. Is on what? Fluoxetine and laxepine. What is the condition the client most likely experiencing? What do you think? What do you think? Is on antipsychotic and an SSRI. He had surgery. After surgery, he has temperature 104, locked jaw, muscle rigidity. Does this tell you this is NMS? Is this serotonin syndrome? Is this extrapyramidal syndrome or malignant hyperthermia? If it's malignant hyperthermia, I will not tell you that the patient take those medication. I will tell you that the patient does now take any medication, he has no family history. I'll focus on family history. But the presence of antipsychotic make me worry. Extrapyramidal syndrome is not it's not acute dystonia, akathisia, Parkinsonism. These are not. Serotonin syndrome, temperature is too high to be serotonin syndrome. I will not even mention lazepine. And I will tell you, serotonin syndrome, you combine SSRI with what? Another medication that has serotonin in it. This patient has neuroleptic malignant syndrome. The presence of muscle rigidity, locked jaw, temperature, and what? Lazepine is what? Antipsychotic problem. 35. And then so in the pediatric floor review, the behavior report from overnight. Once again, psych, integrity. Which one are you having problem with? This is my mental health concepts. Which child should the nurse assess first? They all have a behavioral problem. Who would you see? A child who refuses to eat dinner and skip breakfast? Child pacing in the hallway and yelling foul languages? A child who cries during what? Group therapy? And a child who attempted to smother or a roommate with a pillow? Who do you think you should assess first? Think about it. These are psych prioritization. He refuses to eat and he skipped diet. He's pacing in the hallway and yelling. Child cries during group therapy. He attempts to smother a child with a pillow. I will really, really want to know what each one of you, if you watch this video and you get to number 35, I want you to put down in the comment section which answer choice you pick. And I will show you the trick. All of them, bad stuff is happening. Crying, group therapy is okay. He's pacing, he's going to do something, he's yelling, well, abusive or something. He doesn't want to eat, fine. But if you attempt to do somebody else something, that's bad. The kid is attempted to smother a roommate with a pillow. Bad sign. He's in trouble. This patient is in trouble. Next is caring for a client who express what? Active suicidal ideation and a specific plan. He has a plan. We have a trouble. Which of the following actions should the nurse prioritize? Perform a mouth check after medication administration, administer prescribed antidepressant medication, assign a staff member to stay with the client at all times, remove potentially harmful objects from the client. The reason why mental health is hard is because of this kind of question. I got you. I will show you the key, the way to answer them so that you don't get trapped with anything. If you look at the question, there is specific words in the question. He has suicidal ideation and he has a plan, not just ideation. He has a plan. This patient should never be left alone. Therefore, what do you want to do? It's good to check their mouth. It's okay to give them their prescription, but somebody needs to stay with them at all times. It's okay to remove an object, but you're going to leave. All of them, you're going to leave. There's one, he said, you're watching them like a hawk. I'm staying with you, one-to-one. The most important is one-to-one supervision. Active suicide thought and the plan. The highest priority thought is what? One-to-one. Write it down. A nurse caring for a dying child put aside her own sadness and focus on comforting the parent. This best illustrates which defense mechanism. Think about it. What is the nurse doing? The nurse is caring for a dying child. The child is dying, but she puts her own sadness and tries to comfort the parent. Is this suppression? Is this sublimation? Is it repression? Intellectualization? What do you think? She's not making sense out of the whole thing. She's not repressing a feeling. That's a suppression. These are hard questions, but that's the concept I want you to master. A shy person becomes the life of a party to hide a social anxiety. Which defense mechanism is this? Look at it. Keyword, right? What is she doing? What is she doing? A shy person, right? She's very shy, become the life of the party. She's there. Wow, she's shy, but she now become the big person of the party to hide. What is she? She hiding in a social anxiety. She's worried. So she's like, hey, I want to be the best person in the party so that I can feel great. Compensation, projection, sublimation, and rationalization. You have to know the definition of all of them. Projection is like whatever you are, you're projecting it on somebody else. Rationalization, you're making sense out of it. She's compensating, right? What she's doing is compensating to the situation. A client with an eating disorder is admitted for severe malnutrition. Which action by the nurse is most appropriate? Allow the client to choose when they want to eat, set a structured meal plan and monitor during meal, encourage the client to eat alone to avoid stress, weigh the client daily and let them see the skin. The most important thing is what? What do you want to do? Allow the client to choose when they can eat. No, you should not. That's why they are in the hospital. You set a structured plan and monitor them when they eat so that they don't go and vomit. Encourage the client to eat alone to avoid stress. No, they are in a physiological place. They need to be with people. And when weighing the client daily and let them see the scale. Why? They're going to get mad, but it's not important. The most important is structured eating. Very, very important. A nurse is caring for a client in alcohol withdrawal. Which intervention should be included in the client plan of care? Alcohol withdrawal, what should be your priority? Let me know. Administer lorazepam as prescribed. Monitor for seizures and agitation. Keep the client in a well-light, low-stimulation environment. Encourage caffeine intake to reduce fatigue. Start a low-protein diet to protect liver function. You ask yourself, why are these answers? It's because it's very important bringing your knowledge to psych. But what would you want to do? Alcohol withdrawal, seizures. You need benzos. Therefore, we got to monitor for seizures and agitation. Low stimulation because they're going to have hallucination. Caffeine is going to stimulate them more. Why do you want to live in their protein diet? You don't want to do that. A nurse is caring for a client at weeks of 4. You see, we're changing. Where are we going? What do you think? Can you recognize the condition, the client need we are on right now? Basic care and comfort. 4, we have switch gears. If you have problem with this, which is big in the NCLEX, step back, take a pen and paper, and write all these concepts. I pick very important ones. 4 rigs. Which of the following should be checked at hourly run? Select and apply. When somebody is at risk of 4, do you check their bowel movement, whether they are in bed, whether they have pain, and then whether they are personal activity, personal items are within their reach, and placement of assistive device? What do you think? You see these questions from Adaptation NCLEX? Are they hard? No, they're test taking strategy, testing your knowledge. What do you think? You always want to see if they poop so that you can clean them, so that they don't get out of bed. You want to know where the bed position is located, right? What is their pain? To address their pain. Personal item is number 1, so that they don't get out of bed. And of course, they have things they can use to support them when they get out of bed. I'm answering questions the way I want you to approach them. Don't make it difficult. It's all concept, straightforward. Bring the concept, look at the answer choice and see, does it make sense to what you know? And nurse is planning care for a client post-hip replacement. Underline it. Underline hip replacement. That is where the answer choice is going to come from. Which intervention should the nurse include? This. And I read it from the back. Select or apply. I'm not picking everything. Intervention. I got to do something about a patient who is post-hip replacement. That means all of this, they're doing something bad. And I need to intervene to prevent problem. That's all. And what do I need to do? Keep the operative leg apart. Yes, I should not bring it together. Abduction is good. Allow the client to cross their leg when sitting. Do you want to do that, nurse? Give pain medication and use ice as needed. Check the surgical site for signs of infection. Encourage ankle exercise and use compression device. Help the client walk and teach a safe weight bearing. If you are the nurse and you break down the question, hip replacement, intervention to be included. Include it in your plan of care. I should not bring the leg together. The leg are not together. I like it. Across the leg is opposite that. I'm not picking you. Give the pain medication. I'm good. Help with the pain so that they can get out of bed. The better their pain, the better. Check the surgical site for infection. It's good. Do you want them to exercise? Yes, it prevents DVT. And what about this? Help the client walk and teach safe weight bearing. Look, they cannot go out of the hospital if they are not walking. So that is the key. If you're not walking, you're not leaving. So this one, number 1, is right. We give them their pain medication, check for infection, use compressive devices, and help them walk. And nurse is teaching the parent of a child schedule for EEG, encephalography, in 72 hours. We're just looking into your brain and see if you're having seizures. That's what it means. Which statement indicate correct understanding. This is different from ECT, electroconvulsion therapy, where we induce seizures. It's different from EEG. I want you to take a pen and paper, read about it. Or check Adaptation class. I have videos on the Psych. There is a difference between this. EEG, where we look into your brain for seizures. ECT, we use it for depression, where we stimulate what? Seizures to help with your depression. Therefore, which one need indicate correct understanding of the procedure? My child should avoid caffeine for 1 to 2 days before the test. My child need to be NPO after midnight before the EEG. I will wash my child hair with oil so that the electrodes stick better. My child will receive sedative help and let them sleep during the procedure. What do you think? Which answer choice you will pick? EEG. You don't need any sedation. Gone. Of course, you need electrode, but oil will let them stick. Make the pad not to stick well. You don't need sedation. You don't need to be NPO. You see how I did it? Therefore, this is the patient that we have to see. Avoid caffeine. Why? It affects with the brain activity and it will affect the study. And then she's planning care for a client after what? External fixation of a tibial fibular fracture, XFIX. Which intervention should be included, including the plan of care, basic care and comfort? You taking care of this patient as XFIX. You know XFIX. Basically, you have a fracture in your leg, and then we have this rod in your leg to hold it in place. Monitor pulses distal to the XFIX device. Elevate the leg to reduce edema. Clean pin sites with steroid technique. Loosen clamps to relieve pressure. Watch for redness or drainage. Monitor bed rest until the device is removed. Guys, we are on 44. How are you doing? We're almost done. I want you to stay with me because we will get this done quickly and you will not learn something. By the end of this, all these concepts, you've mastered it because I know you're writing it down. XFIX is a common question you may see. Basic care and comfort, because there's specific things. Always they're going to ask you what I've written there. Pain, information about infection. Therefore, what do you think? What are you going to do for this patient? Of course, we're going to check pulses. We're going to elevate so that we can have less edema. We're going to cleanse the pin site with steroid. Don't use hydrogen peroxide. Don't loosen the clamp. It's not good. We're going to watch for redness. And the patient does not need to be bed rest until the device is removed. They can get up a few hours later, 12 hours. But otherwise, they will develop DVT. You should not stay in bed until the device is completely removed. You can ambulate because patient go on with that. And then 45, almost done. Because of the case study, we have less questions to deal with. All the questions were in the case study. So stay with me. We're almost done. A diabetic client is unconscious with cold and clammy skin. Pay attention. Diabetic, buzzword, cold and clammy skin. What do you think will be going on with the diabetic patient who look like they are in shock? Which next actions are appropriate? Check the blood glucose level. Give them IV, give them IM glucagon or D50. Reassess the client vitals. Give them 50 grams of, administer 15 grams of oral glucose. What do you think? What do you think in this situation? There's only one thing that can be happening to this patient. If you look at the buzzword, unconscious, cold, and a clammy skin, patient probably hypoglycemic. The least thing you can think of. And he's unconscious. That means you cannot use their mouth. Every time you see a diabetic patient who may be hypoglycemic, I want you to write this down. Two things you ask yourself: unconscious or conscious? That means if you're conscious, I can use your mouth. If you're unconscious, I got to use IM or IV. That's all. So pick an answer choice that talks about IM because this patient is unconscious. And then she's assisting an immobile client with what? Complete bed rest, right? Complete bed rest, which action promotes both comfort and safety. Always go for the buzzword, comfort and safety. Therefore, answer choice should what? Have comfort and safety. I don't know how I can explain it to you, but comfort and safety is the key. expose the entire body to wash efficiently, that does not indicate comfort and safety. Use hot water to remove oils and bacteria. What do you think? Let me know. Keep the room warm, cover areas not being washed. What do you think? Skip oral care to avoid aspiration. Why would you do that? Therefore, we have 2 and 3, B and C. But which one is more reasonable? Hot water versus warm water. You can see we got to put some warm water on this patient. Hospital client report difficulty sleeping. Buzzword, right? Due to frequent nighttime vital check. Which action should the nurse take to promote sleep? Administer a PRN sedative, combine care activities at night, leave the light on for safety, encourage daytime nap longer than 3 hours. Let's break it down, guys. And I want you to put down your answer in the comment section and let me know. But let's break this down. Read it from the back. The nurse to promote sleep, something to promote. Patient is being in a hospital. He can't sleep. Why? It said due, because you've been coming there at night, frequent vital check. Sedation does not help with that. You just ignore patient complaint. Oh, I combine activities and I come there once. Good job. Leave the light on. He's not going to sleep. Daytime sleepy will make you not to sleep at night. Therefore, what do you think is your answer? You can see when you break down the question, this is easy. And this is caring. That's what way I think about best care and comfort. It's a little bit live, but there's a strategy. The answer choice is in the question. I'm telling you, if not somebody tell you otherwise, forget about it. The answer choice is in the question. And nurse is caring what? For postoperative client who report severe pain, what? 8 out of 10. But it's due to the nurse dose opiate is 45 minutes. You see what I told you? He has pain, 8 out of 10. That's a lot of pain. And what? The medication that is due is 45 minutes. Which nursing action would you do? Prioritize. Offer a back rub to help. Notify the provider for early dose. Encourage the client to ambulate in the hallway. Explain the pain medication is not due yet. Best care and comfort. If you're taking care of this patient, provide some best care and comfort. What would you do? Offer a back massage and guided imagery is good. 8 out of 10 pain is not going to help. Let the doctor know to provide early order. Do you think it will help? It's much better than letting the patient walk. It can walk with 8 out of 10 pain. And explaining to them that they know due means you're not providing best care and comfort. Adapt NCLEX. A nurse is caring for a client with hearing loss. Buzzword, hearing loss. Or the answers should be consistent with somebody who have hearing loss. That's all. Which actions by the nurse require intervention? A pick concept that they will ask you. If you see a question on hearing loss, you will see this information. That's why you should write the concept down, not the answer choice. How to answer that question. That's the concept. What? And then speak in a high-pitched what? Voice. The patient can hear or not. It cannot. But what would high pitch do for them? They can hear you. You can scream everything. That's the trap. Just because they can hear, you should be screaming at them. And let's directly face the client when speaking, because they're going to develop their senses, visual senses. They're going to look at your mouth. They can tell what you're talking about. The nurse dim the light when speaking. They cannot look into your mouth when the light is gone. Nurse ensure hearing aids are functioning. You're making sure the supporting device is helping them. Nurse uses facial expression and hand gesture as needed. Like I said, their vision is now more developed. You see the way I tackle the question? Please do that. If you watch Adapt NCLEX, if you new, subscribe for more content like that. Share this video with your friends. Put down your comment. Let me know how you're doing. Let me know your test date so that and content that you need to help you pass your NCLEX. Therefore, intervention. Yeah, don't be yelling at a blind patient. You should not dim the light. And then she's teaching a client with a new ileostomy. New ileostomy. What do you think? Is a body image. Which of the following should the nurse instruct the client to avoid? Empty the pouch regularly, drinking inadequate fluid, eating a balanced diet, and high fiber food that can cause obstruction. I intentionally put it there to help you think. Most people will remove the high, but this question is designed to test your knowledge that if I put high fiber food, don't pick it. Don't pick it. The adjective there is giving the answer away, but it's intentional because we're learning so that you can know the trap. So high fiber diet is not good for this patient. Let's do it. Question 51. You can try it and put it in the comment because this is a math question and I know you got it. But this is the way you do it. I'm going to give you a strategy to answer it. And this is calculating intake and output for the shift. What is the client output in total ml to the nearest whole number? 6 o'clock, wet diaper, 20 grams. 12, wet diaper, 30 grams. 1400, emesis, 40. 1800, wet diaper, 40. Dry diaper is that. To calculate total output, diaper is an output. There was 20 grams. You got it subtracted from dry. Dry diaper is -5, so you get 15. At 1200, same thing. 30 grams, you subtract it from 5, you get 25. At 18 to 40 grams, subtract it from 5, you have 35. So you have what, 40 here and 35. So 75. And then emesis is 40. You got to convert all of them into ml. So we have 40 ml because they told you output in ml. 1 gram is equal to 1 ml. That's how you can do it. Therefore, 75 is also 75 ml. And then you had a total. So that should be your right answer, which will give you 115 ml. So that's the way you calculate it. You can stop the video, calculate yourself, and see how it goes. Okay? And the UAP both are caring for a client. The UAP informed the nurse that redness at the sacrum during turning. What is the nurse appropriate action? The UAP told the RN, I find something, there's redness. Do you notify the wound care to come and take care of it? Do you instruct the UAP to document the finding? Do you assess the patient or appear barrier? You should not take whatever UAP told you as the final answer. You should do your assessment. If you have issue with maternity, I've done tons of video, maternity. They're on YouTube. Serious, watch them. You cover everything. 10 videos. You will be comfortable. Maternity and newborn are painful. That is the way you can master them. Let's master them. The client in the second trimester asks when she will begin to feel the baby. We call it quickening, which the nurse should respond that quickening usually occur what? The reason why these are hard questions for maternity is antepartum is very difficult, pregnancy. But you have to know these little details. These normal, write it down. If you don't know, when you see it, quickening, when does it occur? That's all. When does it occur? 8 to 10 weeks is too early. When does it occur? It's getting to the second trimester, right? 6 to 10 weeks it's too early. 12 to 14 weeks, too early. 28 to 30 weeks is too far. So we do it. This. These are normal finding. Mommy will know. And you should put down a note down so that you can remember them. And let's explain erythroblastosis fetalis to a client. Which maternal condition places the fetus at risk? Even if you don't know, AB incompatibility, RH problem, gestational diabetes, and preterm labor. Look at it. Erythroblastosis fetalis. I will break it down for you because Adapt NCLEX try to make things easy as much as possible. Fetalis is the baby. Erythro is some red cells. Blastosis is dying. What have you read about that when during pregnancy, there's going to be some baby dying because of something related to blood? Which one do you think? Which one? Do you think is ABO problem or RH? It's always RH negativity. So that's where it's coming from. So RH negativity is the key, right? This is the key. RH mother giving birth with RH positive is our risk for erythroblastosis fetalis. So when you see it in the question, no matter how they do, it's always RH. Don't pick AOB, ABO problem. And this is reviewing a client signs and symptoms. Please know this one, know this one, know this one. Signs and symptoms of pregnancy. Which one is considered probable? Right? Probable is not presumptive. Presumptive is mommy telling you, subjective. Probable is taking objective value. You're doing vital signs, right? Vital sign. So when you do a vital sign, you check a pregnancy test. It's a vital sign. When they tell you the baby jumping up and down, going to the cervix, ballotomate, right? When you check the uterus, cervix, and the vagina all together, you can find ego sign and Chadwick sign. These are signs and symptoms we see. But it's felt by the client. It's the client talking. That is presumptive. It's not. You know how to calculate it. A client who is currently pregnant, 1, has 2 full-term baby, 2, 1 is preterm, 1 is abortion, and 3 living. How will you label it? Guys, number 56. I would like to know what everybody who has made it so far. And thank you very much for watching that far to question 56, maternity section. And if you're here, thank you again. If you've not subscribed, subscribe to Adapt NCLEX. If you don't make any comment, put a comment. If you don't like the video yet, put the little bit of like button so that YouTube can promote this video to people who need and also support the channel. But what is the key? I'm pregnant already, so I have 1G, 2 full-term baby before, 1, 2, 1 is preterm, 1, and 1 abortion. So I have a total of 5. I look at the answer choice. I cancel this. I have 5. I have 2 term baby. So G2, where I see this, I see that this is wrong. Therefore, this has to be the right answer. But I will check. Preterm, I have 1. Abortion, I have 1. Right? And how many baby living? 3 living. So 1 is the right answer. That is the easy way to answer this kind of question based on terms. And this is assessing the client in active labor, right? The fetal station is documented as what? -2 station. What interpretation is correct? Presenting part is engaging the pelvis. Presenting part is 2 centimeters above the ischial spine. Presenting part is at crowning. The presenting part is 2 centimeters below the ischial spine. If you don't know the maternity, I want you to write it down. Please, 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 if you forget it, whenever they give you a station, the station is towards the ischial spine reference. So 0 is ischial spine. Positive is down below the ischial spine. Negative is above the ischial spine. And then you can use it to answer the question. Break the question down before even you look at the answer. And what I told you, I got to be above. And this is assessing a 1-hour newborn. Expect that. They'll give you normal and abnormal finding. You got to figure out which one is abnormal. Which finding will require follow-up. Select and apply. Sugar, 450. Small and low set years. Diaphragmatic breathing. Apical heart rate of 100. Temperature, 97. Triangular shape, posterior fontanelle. Diamond shape, anterior fontanelle. Have you seen these questions before? It's a bunch of questions I put it together. Content to test your knowledge. Which one require follow-up? That means they are abnormal. Is any of them abnormal? What do you think? Is any of them abnormal? What do you think? This sugar is too low. Which one would you choose it? Small, low set, yes, we got to follow up. It may be Down syndrome. We don't like it. Right? Diaphragmatic breathing. The heart rate, they usually breathe diaphragmatic, and 60 is the borderline, so it's okay. The baby heart rate is 110 to 160, but he's sleeping. 100 is okay. Temperature is too low. His fontanelle should be open. It said 1 hour. And the shapes are consistent. Triangular shape, posterior fontanelle. I want you to write it down. And the diamond shape of a what? Triangular shape of posterior fontanelle and the diamond shape of anterior fontanelle. These are all normal findings. These are problematic things we should worry about. The postpartum room and sees the newborn in bed with the mother, both asleep. What is the next best action? Wake the mother and encourage her to continue bonding. Quietly leave the room to avoid disturbing them. Gently move the baby to the bassinet. Document the skin-to-skin care in occurring. This is a tricky question. It's designed to test your knowledge. It's designed so that you can know what the NCLEX can do to you, nursing school can do to you. These are concepts. But what do you think is in the question? Should the mother be sleeping in bed with the newborn? That's all. SIDS, right? Sudden infant death syndrome. We want to prevent that. Therefore, what answer choice will you pick? I know you know the answer because you watch Adaptation class. And I thank you for watching this video. And I know you're learning something. So what do you want to do? Wake the mother, encourage her to continue bonding. It does not answer the question. SID. Gently leave the room and avoid disturbing them. You're causing SID. Get the baby to the bassinet. A nurse is preparing to administer erythromycin ophthalmic ointment to a newborn. What is the purpose of the medication? What is the purpose of that medication? It's antibiotic. What is it going to prevent? Conjunctivitis, infection from group B, to prevent high infection from chlamydia and improve the baby vision. It's not going to improve the baby vision. This is an antibiotic. It's not for conjunctivitis. And what do you think? This is very, very important. It's one of the things we do all the time. This is specific for chlamydia. If you don't know, please write it down. It's mostly for chlamydia and gonorrhea because that's bad for the baby. And this is in the emergency department is caring for client. You see, we've switched gears. You see some infection. Which client should be placed in private room? Safety, infectious control. Safety, infectious control. I think if you got a concept, you can answer every question on the NCLEX 100% on infections control. And if you need help, let me know. Adapt NCLEX as a strategy to answer that. I'll show you how to answer them here. This one look intimidating. Client A, B, C, D. It does not matter. I give you the diagnosis and I spread it. I say itchy vesicular rash spreading from the chest to the face. What diagnosis will you give it? Circular bullseye rash after hiking. Key. Red facial rash spreading from the trunk and mild fever. Intense itching, night itching with burrow-like tracks or on the wrist. If you don't know, I will show you words in the question. Itchiness, burrow, mostly scabies. These two rash, I don't know what it is. Bullseye is always for Lyme disease because I'm hiking. Now you have A and C. Which one is dangerous? I see vesicular. Every time you see vesicular lesion, think about varicella. So that's the one we're picking. Okay, think about varicella. And this is the explanation. You can take a picture of it. But A is varicella, highly contagious because it's airborne and contact. Negative pressure is needed. Lyme disease, no isolation. Rubella is a droplet precaution. And then I don't know what rubella, even if you don't know what C is, but I know what it is based on the description. And C is a contact precaution. The pregnant nurse is assigned to care for several clients. Which one she should avoid? Rubella patient, impetigo, ringworm, and mononucleosis. Mononucleosis is standard precaution. I'm going to give you the straightforward. Ringworm, standard precaution, but mostly it can be contact, depending, but most of the time, standard precaution. Impetigo and rubella, which is dangerous? The main idea for this question is teratogenic. Which one is teratogenic? Rubella. That's why we check rubella titer all the time. E. coli, and patient is incontinent to stool. A client with E. coli incontinent to stool. What action should the nurse take? Don't worry. E. coli is what? Dysentery. It's GI problem. Diarrhea. If you cause diarrhea, most of the time, contact precaution. And therefore, I'm going to institute contact precaution. What do I need to contact? I need to protect myself. I need a gown and gloves. I don't need a mask. So protective gown and gloves when I'm going to the room. Surgical mask is out. Negative pressure room, I don't need that. And 95, I don't need that. You see, if you do that, these infectious control questions is a freebie. You will ace them, no matter what. And nurse is providing care for a client with what? Pediculosis capitis, which precaution is most appropriate. Once again, stop the video, come up with your own. I have a bunch of mnemonic to find them, right? If it's what? Mrs. Way hips for contact, right? And the airborne MTVS, you can use that. But all of them, Spider-Man is for droplet. But find something that you can work with. And you have to recognize what these guys, pediculosis capitis, head lice. This is contact. Institute contact precaution. It's not droplet. It's not airborne. I'm going to institute contact precaution. See how the questions are not difficult, but content related. If you master it, you can figure out what is the best action by the nurse when caring for a client with Clostridium difficile. NCLEX is not going to give you the same. It will give you the same thing. They just put a different language around it, put some meat and try. If you go to any Q bank, the same thing. They take Clostridium difficile and they try to make it fancy. It never changed. No matter what words you put around the concept, it never changed. Just focus on the concept, not the word. It says C. diff. And what does C. diff? Contact precaution. What am I going to do? Contact. Wearing gloves and using hand sanitizer after care. Does that sound like contact to you? Wearing masks within 3 feet. Does that constitute contact? How does wearing masks help with contact? Washing hands with soap and water after client care. After you take care of your care, you wash your hand with soap and water. Placing the client at an airborne precaution. What do you think? You can see B and D are wrong. Now you're left with A and C, and let's break them down. Break them down. Which one will you choose, A or C? Let me know. C. diff require absolutely wash it with what? Soap and water. So she used hand sanitizer. He or she. Even though she wear gloves, she use hand sanitizer. I'd rather pick this one because that person use soap and water. And that's the way you can answer them. And then she's assigning room for new admission, which client can safely be placed together. How do you cohort? I said same organism, not the precaution. What does that mean? Write this down. I have a bunch of videos, YouTube shorts about it. Same organism. That means the same organism, MRSA and MRSA. But you cannot put MRSA and scabies, even though they are all contact. not the precaution, but the organism. Influenza and what? RSV, they are droplet, but they are not the same organism, different names. Scabies and shingles, different names. Strep and what? Bacterial meningitis, same droplet, difference. Two MRSA, they can be put together, even though the organism are the same. So D is your right answer. And then she's caring for a client diagnosed with what? Tuberculosis, which action demonstrate appropriate infections control precaution. This is what I just said earlier on. They take the information and put language there to confuse you. What did I do? Demonstrate appropriate infection control precaution. It never changed the meaning of the question. So write it down. It said TB. All I'm doing, what do I do for TB? That's all. Select or apply. I'm not picking everything. Wearing a surgical mask when entering the client room. A surgical mask is a TB. What do we need? You need airborne. Is surgical mask enough? Negative. Don't pick it. I know a lot of people will ignore the surgical and will pick it. Done. It's a select or apply. Don't pick it. Assign the client to the private room under droplet. It's not droplet. It's airborne. Wear a particulate respiratory mask when entering the room. N95. It sounds good. Place the client in the room with another client with MRSA. They cannot be, not the same organism. Place N95 on the client for X-ray. When the client leaves their negative pressure room, they don't wear anything. Once again, except what? Surgical mask. They don't wear anything except surgical mask. So when they leave their room, all you put them on is surgical mask. Okay, and you don't wear anything. Therefore, this is wrong. You can see, select or apply. It's only one answer choice there. If you pick more than one, you get 0. And that's what the NCLEX will do to you. You should look at this question again. A client on warfarin therapy developed new infection. He started with amoxicillin. The nurse recognized that this combination may do what? What did you notice? Now we're talking about medication. We are on what? Pharmacology, IV therapy. Which, like I said, client needs. So this is another category. We finished with infectious control and safety. We're on pharmacology and what? IV therapy, therapeutics, right? What do you think? A nurse recognized that this combination would do what? Increase the effectiveness of warfarin, increase the risk of bleeding, decreasing the effectiveness of warfarin, increasing the risk of clotting, have no effect on warfarin, and causes decreased level of amoxicillin. I want you to write this down. This is one of the teaching. It's something when you know you are ahead of your classmates, because look, if you know that certain combination with warfarin causes problem, when you see it in the select or apply, it will be there. And one of those things is antibiotic. We have to pay attention to that. If you take antibiotic, new antibiotic, it can increase the effectiveness of warfarin. This will make you more bleed, right? It can cause warfarin amount in your blood to increase, and therefore INR will go up. So this is a problem. This is something I want you to know. The amoxicillin can alter the gut flora, right? And increases warfarin effect and raises the bleeding risk. And this is teaching a 54-year-old client prescribed digoxin and dabigatran for AFib. Which of the following instructions should the nurse include in the teaching? Look, how do you answer the question? There's 2 questions there. Patient is taking digoxin and dabigatran. Dabigatran, you got to identify it. This is anticoagulant. It's factor 10 direct inhibitor, right? And this is digoxin for rate control, and this is for anticoagulation. They're doing something different. The answer choice said what? Check apical pause for 1 minute before taking. Do you tell them that? Should you include in the teaching? Avoid green leafy vegetables. Do you include in the teaching? Take salt substitute. Should you do that? Avoid local rice. Do you do that? Need frequent lab draw. Is it part of your management? Monitor PT and what do you think? put down in the comments your answers. And then we break it down. Check apical pause for 1 minute before taking the digoxin. The question says, which of the following instructions should the nurse include in the teaching? This is appropriate. Avoid green leafy vegetables. I did a video on this medication, dabigatran, these factor 10 inhibitors. They don't need any diet changes. Therefore, avoiding green leafy vegetables is bad teaching. Taking salt substitute will increase your potassium. Digoxin, whether you increase your potassium or decrease your potassium, sometimes it can affect that. So you should not do that. So don't include. Avoid local rice is good because it leads to hypokalemia and that can worsen digoxin. That's good. You need frequent lab draw. That is good. You need to monitor your PT and INR. That's good. Know this, watch this multiple times. This pharmacology is key. And nurse is reviewing prescription for 4 clients. Pharmacology can be daunting, but you got it. Which prescription should the nurse question? There's a strategy to answer this type of question. I got you. Don't worry. Divide this into 2. Fluoxetine. Should you combine with what? Acetaminophen in the patient who have anorexia. Citalopram. Patient on sildenafil for depression. Nafazodone. Taking tramadol for depression. And that's Zimpam. What do you think for panic attack? The question say you should question. SSRI, and I take acetaminophen, I'm good. Sildenafil, there's nothing to do with SSRI. It doesn't affect it. This is serotonin agonist. Nafazodine serotonin agonist. This is SSRI, right? Fluvoxamine and oxazepam. This is diazepam. Therefore, C is in trouble. We should question. 2 SSRI, I can combine it together. This is a problem. These are bad problems. Same strategy. Which prescription should the nurse question? Amazepine and methimazole for what? Depression. Clomipramine and saline nasal spray for depression. Bupropion, lithium in bipolar patient. Citrulline and diazepam in severe anxiety. What do you think? Put down in the comments and let me know. But these pharmacology combination, you just have to figure it out. Which one can you combine? What do you think? I know you got it. I know you know this. Let me know. It's a psych medication. Amoxicillin, you have to identify what it is. This is amoxicillin. What is it? It has anticholinergic effect. And therefore, you're going to have constipation. If it's constipation, I give you methimazole. Clomipramine. This is what? What do you think? What medication is that? It's TCA. TCA also have anticholinergic effect. I'm giving you nasal spray for depression. Yes, so that it can help with what? Dry nose. Bupropion for lithium. It makes you hyper. Lithium is already hyper. They should not take it. SSRI and benzos can be put together. This is the way you see these questions. But you got to figure out how to answer them by connecting the 2 together. Same thing. With drug combination, I intentionally make them all of them like that so that you can know when not to give it. And this will help your understanding of the pharmacology of that medication. Selegiline, I have nasal decongestion. Is it okay? Decimapramine, phenoxin, lithium, ACE inhibitor, Vopric, and oral contraception, carbamazepine, and olanzapine. Think about it. This one is good for you to think about. And I leave that to you. So put it in the answer choice. We are almost done. A few more questions. But put it down. Let me know what you think. What do you think for 72? What do you think? What do you think? Selegiline is MOI. You should not take nasal decongestion. It's going to increase your blood pressure. We should clarify. The same decipramine. Decipramine is what? It's a TCA. You should not take it with what? Phenoxin, which is MOI. Bad problem. You see what I'm doing? Lithium, ACE inhibitor will affect your sodium problem. Valproic acid, you should not take oral contraception. You use barrier method. Carbamazepine can be used with what? Antipsychotic. So those are your right answer. We are 6 more questions. Because we did a case study, the case study questions, there were multiple subunits. And so we have 6 more. Are you with me? Wake up. Let's get this done. And if you're with me, just put in hashtag. I'm finishing this. And next, observed a male client pacing and unable to stay still in a room after 8 weeks of on clozapine. The nurse should anticipate which prescription. What do you think? Olanzapine, fluoxetine, phenytoin, and diazepam. Think about it. Which answer choice will you pick? Look at it. Break down the question. And next, anticipate what? Which prescription is causing it? Is a male, is pacing. That's the buzzword. Unable to remain still. Another buzzword. Rewrite it in your own. What do you think not able to stay still means after being on what? Clozapine. It's an antipsychotic. This is what we call acute what? Akathisia. This is akathisia. Akathisia caused by what? Antipsychotic. How do you treat it? Anticholinergic, anticholinergic, anticholinergic. If there's no anticholinergic, slow them down. You can use what? Non-olanzapine is also antipsychotic. Fluoxetine is SSRI. Phenytoin is MOI. What do you give? Based on that, benzodiazepine. That's the way you answer this question. The client with type 1 diabetes is prescribed regular insulin and NPH to be given at breakfast, 7:30. The nurse understands that the peak effect of this regular medication, which is regular insulin, will occur what? What is the peak of regular insulin? That's all. That's what the question is asking you. I know you know it, but what is the peak of regular insulin? And use it to answer the question. It's 1 to 2 hours. Therefore, add 1 to 2 hours to this. 1 p.m. is too far. This, what do you think? I know you know it. 1 to 2 hours from 7:30 to this, 400 that. That's all. Almost done. This will look intimidating. Immunization is straightforward if you know the key landmarks and the age. A nurse is providing teaching to a parent of what? 4-month-old infant on routine immunization. Which vaccine should the infant receive during the visit? Is 4-month-old. This is what you have. I will show you strategy. When you see immunization question, I want you to pay attention to the big eyes, MMRI, and the varicella. Those are big at a later date, usually after 1 year, 15 months. And therefore, based on that, look at it. I'm cleaning this off. This is wrong. This is wrong. This is wrong. They all have one. I'm picking this. You see? So that's the way you pick it. And this is the answer. At 4 months, they get DTaP, IVP, and HIB. Rotavirus are standard immunization, which can be given later on. But it depends on which. But MMR is the key. So pay attention to that. And this is caring for a client who has been prescribed what? Dofetilide for AFib. Which intervention is the highest priority when initiating this medication? Monitor for blood pressure every 4 hours. Check potassium and magnesium. Assess for signs of heart failure. Encourage the client to increase dietary potassium. You may not know this. It's okay. We are learning. There's some medication you may not know, but I'll show you. AFib, right? I don't know what medication is. But they say highest priority. That means something, if I don't do it, is going to kill this patient. Of course, 4 hours monitoring your blood pressure, come on. It's far away. That's routine vitals. They say, oh, potassium and magnesium level. I check it. Wow. And the question say, highest priority when initiating. You see the keyword initiating the medication. That means before you give the medication, this said checking 4 hours, every 4 hours. It doesn't answer the question. They're asking you now. You see how one word changed the question Initiating means you do it before you give the medication. And the question answer one said every 4 hours. Wrong. This may be a potential. You say, I check it before I give. Assess for signs of heart failure. Okay, I will assess for it before I give. Encouraging the client, that will be later. When he eat potassium, it's going to take a while. Then you left with this. What do you think? Assessing for signs of heart failure. This is checking for what? Potassium and magnesium. Heart failure is dealing with the AFib. And potassium and magnesium is dealing with the medication. That medication causes QT prolongation. I want you to write it down. If you've never seen it before, dophytilide. It causes QT prolongation. How does it cause that? Due to magnesium and that. So if you know it causes QT prolongation and you see an answer choice with magnesium, hey, that's your boy. You got to pick it. This is the Adapting NCLEX way of analyzing questions, breaking them down, and making questions simple. Content, simplicity. That's Adapting NCLEX model. 3 more questions. A nurse is preparing to insert a peripheral venous access device for a client. Which of the following vein is the best appropriate site for placement? If you're in nursing school or taking the NCLEX and you're doing, or you're in nursing school, doing your clinical, I want you to put your answer down here. And in nursing school, I want you also put down. Let me know, what do you think? Which answer choice is best to place peripheral IV? Basilic, cephalic, medial cubital, and ulnar vein. Which one do you think is the best to use to insert peripheral venous access? There's a strategy there. First, you have to know where the vein is located. So if this is your arm, cephalic, your head, basalic is your base, and they come together and they split. The ulnar is in the middle, it's deeper. So the idea is peripheral. Where is peripheral? A peripheral means something that is superficial. I'm picking a superficial vein. Medial cubital, sometimes we can't find vein, we go there. Why? Because it's deeper, it's in the middle. Basilic is down, it's also deeper. Cephalic is much better because it's superficial and it's straight and you can use it. The ulnar is very small, it's deeper. So that's the concept I want you to master. And that's the way the content, I break it down for you. And this is the explanation. You can take a picture of it, stop the video, and read about it. 2 more questions. A nurse is caring for a client, several clients in the MESIA unit. Which of these patients is higher risk of what? Metabolic acidosis. These are pharmacology questions and some risk reduction. So we switch gear to risk reduction. The last few questions were a risk reduction question. A nurse is caring for the client. Which one causes metabolic acidosis? A client with prolonged vomiting, chronic diarrhea, hyperventilation, excessive sodium bicarbonate, and sepsis. What do you think? Put it down in your concept. Put down your answer choice in the comment and let me know. But I can tell you, metabolic acidosis is you losing bicarbonate and gaining an acid. So which one? If you're vomiting, you're losing acid. Therefore, it cannot be. If you have diarrhea, you're gaining bicarbonate. So this is good. You are hyperventilating. What are you doing? You're blowing out your CO2. This will lead to what? Respiratory alkalosis. If I give you bicarbonate, you're having metabolic alkalosis. When you are in septic shock, there's less fluid going to your what? Your body. Your body have ischemia and you develop acidosis. So those are answer choice that is consistent. Therefore, chronic diarrhea, where you lose your bicarbonate and you're having shock, basically, or sepsis associated with that, that can give you this situation. And those are the ones which should lead to metabolic alkalosis, metabolic acidosis. Last question. How are you doing? 85, you made it. What do you think? It's a risk reduction question. What would be your answer choice? But before that, thank you for making it to last question 86. Even though it says 79, we did a case study, so they are all added. What do you think? And let's provide care for a client at 6-hour post cholecystectomy, which finding is concerning. Shoulder pain 6 out of 10, hypoactive bowel sound, and diaphoretic. What do you think? Which one? Put down your answer. Let me know. Shoulder pain post cholecystectomy, is that should worry you? Incisional pain 6 out of 10, should that worry you? Bowel sign is hypoactive. Those are all normal. If I remove your gallbladder, your bowel sign is going to decrease. You're going to have shoulder pain. You're going to have incisional pain. But if you sweaty, something is wrong. 85 question. Client needs. NCLEX practice question. We talk about physiological adaptation, integrity, psychology. So basically, best care and comfort, basic care and comfort, management of care, all of them we had ABG question, pharmacology question, med surge. We did everything humanly possible to get you through. I hope this benefits you. And if this video helped you learn something, put down a comment, subscribe to Adapt NCLEX for more content like that, and share the video to your friends. And come back for more. Good luck and take care of yourself. Bye.